हाय डियर व्यूअर्स, आई एम डॉक्टर अजय कुमार। आज हम आपसे एक बहुत ही महत्वपूर्ण विषय पे चर्चा करने जा रहे हैं कि जब आप पहली मेडिसिन देते हैं और मेडिसिन काम करती है, उसके बाद भी आप देखते होंगे कि पेशेंट के प्रॉब्लम रिलैप्स हो जाते हैं। ऐसी स्थिति में आप क्या करेंगे? एंड यह जो है यह बहुत ही कॉमन सी बात है और हम सभी डॉक्टर इससे कभी न कभी रूबरू होते हैं। और यह प्रॉब्लम इवन हनीमैन को भी देख झेलना पड़ा था और दैट लेड टू द डिस्कवरी ऑफ मियाज़म। तो हनीमैन ने काफ़ी वर्षों तक इस पे काम किया और देखा कि मियाज़म ही इसके रूट कॉज है, जिसके कारण बीमारी जो है बार बार आती है। तो ऑर्गेनन में आप देखेंगे कि देयर इज ए चैप्टर दैट इज कॉल्ड सेकंड प्रिस्क्रिप्शन। तो सेकंड प्रिस्क्रिप्शन इज व्हाट? सेकंड प्रिस्क्रिप्शन मीन्स जब आप पहली मेडिसिन दी, आपके पहली मेडिसिन ने काम किया और उसके बाद या तो पेशेंट का फर्दर डेवलपमेंट नहीं हो रहा है या पेशेंट का कंडीशन रिलैप्स हो रहा है, ये दो स्थिति बनती है। ऐसे में वहाँ पे जा कर के आपका जो प्रॉब्लम है वो स्टार्ट हो जाता है। और इसीलिए बहुत क्रॉनिक डिजीज में हनीमैन कहते हैं कि we start with a flying colors and so much enthusiasm, and later on the progress is halted in the improvement of the patient, and the case is ended with hopelessness. तो यहाँ पे जब आपने पहली मेडिसिन सेलेक्ट कर लिया, सिमिलिमम भी आपने प्राप्त कर लिया, उसके बाद भी मेडिसिन या तो पार्शियल वर्क किया या वर्क करने के बाद वो पेशेंट का कंडीशन रिलैप्स हो रहा है। तो यहाँ पे जो गाइडलाइन प्रोवाइडेड है दैट इज टर्म्ड एज सेकेंड प्रिस्क्रिप्शन। सो सेकेंड प्रिस्क्रिप्शन कैन बी डन ओनली व्हेन द फर्स्ट मेडिसिन हैज एक्टेड। आपने पहली मेडिसिन का जो चयन किया, अगर वही काम नहीं किया, देयर कैन नेवर बी सेकंड प्रिस्क्रिप्शन। So the first condition of second prescription is that the first medicine is the similimum and it has acted. Either it has acted means all the action of the medicine is exhausted. Whatever the potentiality that medicine has to create a change in the person, in the morbid condition of the person, that is exhausted. उसने अपना सारा काम कर दिया। कहने का अर्थ ये है कि सपोज कीजिए किसी की मेडिसिन आपने चाइना प्रिस्क्राइब किया, तो चाइना का कंप्लीट रेंज आपने एग्जॉस्ट कर दिया। आप 30 से स्टार्ट कर रहे हैं, 200 दिया, 1M दिया, 10M दिया, CM दिया, जहाँ तक आपकी समझ है कि वो मेडिसिन वहाँ तक जा सकती है, वहाँ तक देना चाहिए, पेशेंट का कंडीशन इम्प्रूव कर रहा है। लेकिन उसके बाद कंडीशन अब या तो रिलैप्स हो रहा है या उसके कुछ नए सिम्टम्स आ रहे हैं जो मेडिसिनल सिम्टम्स नहीं हैं, या पेशेंट के कंडीशन में कोई इम्प्रूवमेंट नहीं हो रहा है। इन ऑल दीज केसेस यू नीड ए सेकेंड मेडिसिन। So in the second medicine, while giving second medicine, what you have to do is to take a case fresh. और जब आप केस फ्रेश लेते हैं तो सेकेंड प्रिस्क्रिप्शन में देखना क्या है, हाउ टू गिव सेकेंड प्रिस्क्रिप्शन। तो गाइडलाइन इज आइदर यू गिव कम्प्लीमेंट्री और सप्लीमेंट्री मेडिसिन, और यू गिव एंटी मियाज़मेटिक मेडिसिन। So in many of the cases you will find that there is certain blockage. The blockage at the level of genetics, that is coming in hereditary. So you have to understand the miasm at that point. वो सो रहा है, सिफिलिस है, साइकोसिस है, whatever the miasm that is afflicting the person at that time, and that is foremost, uppermost, that is prominent, that is important to tackle with at first. So your prescription should be based on anti-miasmic if you feel that there is a certain blockage. लेकिन यदि ब्लॉकेज नहीं हो तब क्या करेंगे? आपने एनालिसिस किया, there is no blockage, then what will you do? So at that time you will have, after the analysis, complete reanalysis of the case, and with the present symptom try to find out another simillimum. आप दूसरे सिमिलिमम एक बनाते हैं, और वो जो सिमिलिमम है try to find out either that is complementary or supplementary. It might be possible that the new medicine has no relation with the previous medicine, but in most of the cases where the first medicine has acted, experiences tell that the second medicine comes from supplementary or complementary. And that's why Hahnemann in 161 perhaps has told that in many of times in the cases of chronic diseases we will need a series of medicine to bring about a case to complete cure. एक मेडिसिन से काम नहीं चलेगा, एक चेन में मेडिसिन की जरूरत पड़ेगी. तो दैट चेन जो है वो क्या होगा, उसकी क्रोनोलॉजी क्या होगी, उसकी अंडरस्टैंडिंग आप कैसे डेवलप करेंगे, what relation should be built up among those medicine, that is very very crucial. So you have to understand that certain medicine has relationship with other medicine. It may act as supplementary or complementary. I am citing a case here. एक लेडी, करीब 30 इयर्स की लेडी हमारे पास आई पिछले वर्ष सितंबर अक्टूबर में, and he had suffering from severe migraine, and she has also menstrual trouble. The menses were enormous, copious, and they were coming early at 20 or 20, 15 to 20 days it were coming. And she had tinnitus in the ear, as well as she has nebulothian cyst with bulky uterus, and cyst was at the cervix. Cervix was thickened. And she had also coryza, watery coryza that was aggravated by dust. She was very irritable. She was anemic. And in the history it was found that she had problem ever since she had a miscarriage. And in that miscarriage, she was given blood transfusion. So much blood had drained out. मिसकैरेज के बाद इतना हेमरेजिक टेंडेंसी हुआ बॉडी का, इतने ब्लड निकल गए पीरियड में कि उसे ब्लड चढ़ाना पड़ गया. बट देयर आफ्टर she developed all these problems one after another. So on those things we found that the lady was suffering from anemia, hemorrhagic tendency, and she had severe migraine. Migraine was periodic migraine, hammering type of migraine, and she wants to be pressed. माथे को प्रेस करती थी, बांधती थी. She wanted to lie down and she wanted to complete calmness at that time. She wanted to put her head on something for rest. So given the history that she was anemic and there was a vital loss of fluid, and thereafter all the problem when it started, China was given. And China acted very beautifully, and the lady, most of the problem were solved except tinnitus. All the nebulothian cysts dissolved, migraine ended, and mens became regular. And this continued for some few months. कोई प्रॉब्लम नहीं था. There was certain tenderness thereafter developed in the breast, and that was tackled care with acutes, and everything was okay. लेकिन कुछ महीनों के बाद उसके फिर से सिस्ट डेवलप हो गए, फिर से सर्विक्स में सिस्ट है, फिर से माइग्रेन का अटैक आ गया. नाउ द मेंस वाज स्टिल रेगुलर, देयर वाज नो प्रॉब्लम विद द मेंस. सो व्हाट डज दिस इंडिकेट? This indicate that the first medicine has acted, but there was certain things which remained even after giving the first medicine, and that could not be cured by that medicine because that medicine has exhausted its capacity, and what was remaining was not under the jurisdiction of that medicine to act upon. So here I needed certain another medicine. What I found in later was that in the breast, as I said, that there was pain, and thereafter, in the lab report, when the mammography and chest scan was taken, it was found that certain glandular involvement was there in the axilla. There was glandular enlargement. Some degree of glandular enlargement was there in the right axilla, and the liver was also enlarged. Uterus was still bulky, though the menses were regular. So when I took the case once again and given the history of anemia, the position was still the same, but still what was there now? The new development was the increasement in the size of gland. So still being anemic, still being having migraine of the same time type, and still the causation same, I need a medicine which could complement China. So if you go in the Theorem chapter, Alain writes that China, it complements China. So here Ferramyode was given to the lady. So this is what I am telling to you, that whenever you got stuck in some cases where the first medicine has acted and you need a second prescription, do understand the case thoroughly, do analyze the case, and you go as the organon guides you. Either go miasmatically, go supplementary, go mm, complementary, or if you need that there is entirely a new medicine coming up on the basis of the new symptoms, go by that. Thank you very much for watching me, and do share my